bone tumor was getting progressively worse, and it was waking me up in my sleep. I couldn't get full night's sleeps. I'd be waking up at 3 or 4 in the morning if I missed a painkiller. I was probably taking about three to 4 painkillers per day. And we actually did a calculation, and over a whole year, 365 days, it's over 700 painkillers in a year that I took.
Osteoid osteoma is a benign bone tumor. It's actually a fairly common benign bone tumor. It tends to occur in males between the age of roughly 10 and 35 years of age. It produces a chemical called prostaglandin, which is actually involved in pain pathways. And because of that, very small lesions result in a large amount of pain.
I got to talk to Dr. Temple, and he kind of explained the old procedure, but then he brought up HIFU, which was no needles, no pain. It was non-invasive on the skin, but it was actually like an ultrasound beam that was focused underneath the skin. So I thought that was very cool. I was very intrigued by how they don't have to cut the skin, and they can still get rid of the tumor on the bone.
MR-guided focused ultrasound is a procedure where a patient lies in a standard MRI scanner and has regular images taken, but beneath them is an ultrasound transducer that focuses the ultrasound wave to the target and allows us to destroy the abnormal tissue, and at the same time we can see exactly what's happening by measuring the temperature with the MRI imaging machine.
We are the first hospital in North America, either adult or pediatric, to be able to offer this therapy. The first big benefit is it's completely non-invasive. We can treat patients without having to break the skin. We're not using any radiation whatsoever, and we're decreasing the risks that are associated with the procedure.
I was very nervous, of course, at first, because, of course, nobody else had done this. But I always like to try new things.
He agreed. That's what he wanted to do, and I was on board with it. And his mom was questionable at first. She wanted more information.
Well, I was torn because I was very afraid of something new. You don't want your child to be the first at this without being 100% sure. As this process developed, they were very active in giving us information, answering our questions, actually going above and beyond as well. They came up with suggestions like to come visit the lab where they were doing the research so that Jack and we could see the actual science that was going on, and that built up my confidence.
So this is an MRI of the patient's femur, and right here is the osteoid osteoma, and we've set it up as a target within the MRI scanner. So this is a representation of what the ultrasound beam looks like. You can see it's focusing right on the lesion itself, and while we're doing the treatment, we're actually able to measure the temperature just on the surface of the bone. So that tells us two things. It tells us A, we're in the right place, and B, that we're achieving an adequate temperature to obliterate the osteoid osteoma.
Things have gone very well for this patient. I received a message from his family about 48 hours after the procedure to say that the pain related to the lesion was gone.
By the time I was going to bed, my leg was starting to calm down. Like, my dad said, "Do you want to take a painkiller?" I said no. And that was the first time I said no to taking a painkiller. I went to go lie down for bed, and it was almost like somebody just went, and it was gone. I can do more things now that I couldn't do before without getting a jolt of pain.
The potential for high-intensity focused ultrasound for both medical and surgical procedures is huge.
So this is currently an investigational procedure. We plan on doing 10 patients and then looking at our results, but the results so far look very promising. And once we have got to that stage and we're happy with that, then we'll begin to network with other pediatric centers, and hopefully this can become a standard procedure across North America and worldwide.
For us, it was an overnight success. To see him in so much pain and to be living around that schedule of pain management, and overnight it was gone.
Mm-hmm. The next morning, I woke up with the biggest smile on my face. Yeah. So I was very happy with how it turned out.
So innovation's the future. You know, we want medical care to advance. We all think it's going to go minimally invasive or non-invasive, and we think we're on the forefront.